physician-assisted dying in Oregon. After 15 years of looking at the facts, we are able to draw some conclusions about how to improve end-of-life care in the world. And so the facts do pose an opportunity to draw conclusions. My purpose is to add experience and fact-based information. Oregon has come a long way in closing the data void that existed prior to the law being passed in the state of Oregon. Oregon was the first place that was practiced where it was practiced in a legal environment, and the state of Oregon took very seriously its responsibility as a laboratory of the states to compile good information. It's not just the state that collects data, but we have organizations other than the state that are corroborating this data. My purpose is not to defend the Death with Dignity Act. In fact, the facts generally speak for themselves, and I'm not here to debate whether it's right or wrong, because physician-assisted suicide is a legal option in the state of Oregon. It just doesn't matter what we think. Dying Oregonians can and do choose from among all options, including the Death Hospice and the Death with Dignity Act. In approximately 0.14% of people who have died in the state of Oregon in the last 15 years use the Death with Dignity Act. There were 450,000 people overall who died at that time. We can talk about some of the people who have used it. It was predicted that men would be more likely to use it. 52%, which is generally pretty much half, have actually done it. It was predicted that people who lacked social support would be more likely to use the law than others. People who were divorced, married, are slightly more prevalent in this group, but 45% of them have been married. Now, the hospices have been in a position to compare people who have used the Death with Dignity Act and who have not. Overall, more than 90% of the people who have used it, who have ended their lives, have been enrolled in hospice, and hospice workers are really pretty good monitors, and they do document everything.
May I?
Yes, please.
A question that was raised, and that is of concern, was that an advocacy group is giving the information to the state of Oregon, which is the information that's informing us. So can you just use my format and tell me again what I think I heard?
I think the state health division does an excellent job at reporting under the way they're supposed to do, and the kind of data that is collected and reported. But
I thought you were saying that hospice was also collecting in-home monitoring. Hospice.
When you have 98% of people in the last 3 years who are enrolled in hospice who use the Death with Dignity Act, so the hospices themselves become monitors. They are in a position of, did somebody do something wrong? Has there been, where are the patients' families? There will be the families too. They're in the patient's home. Have these patients been coerced? And they have been asked for the positions on this, and we do have data about that, and we'll look at it. We also have the data, the studies that I participated in corroborate that the state health division is accurate. We also have had, in 2005, the Oregon Susan Toll and the ethics group of OHSU revealed pulled out all of the death records that indicated 4 people who had not indicated that they had used physician-assisted suicide or who had taken a prescription. They pulled out 1,400 individual caregivers of people who had died in the state of Oregon who were not, am I making sense, who were not had not used it according to any of the records that we had. These included all of the caregiving from every minority person in the state who had died in the state of Oregon out of the sample. And in that report, they found not one single instance of an unreported case of death due to dignity. And they also revealed that they were able to come up with some other data, for instance, that out of every 200 people who would consider, who had thought about using a prescription, according to what their family members indicated, only one would ever use the prescription in fact. Out of every 25 individuals who actually talked to their doctor about a prescription, only one of those individuals used the death with dignity.